look, if we don't change the way that we're doing business in Washington, have you seen the approval ratings of Congress lately, my friends? You talk about the low approval rating of the president. When you get down as low as the approval ratings of Congress today, you get down to paid staffers and blood relatives. I mean, it's hard to, has anybody met anyone like who approves of Congress, except for if there's a member of Congress here, but, so, or their family, or, anyway, so we've got to restore trust and confidence. What's the best way to do it? Is to stop the wasteful and unnecessary spending. Does that solve all our budgetary problems? Of course not. But if you're going to spend billions and billions and billions, and if you're going to sponsor and seek special projects and special earmarks, special things like the $3 million to study the DNA of bears in Montana. I don't know if that was a paternity issue or a criminal issue, but when families are in need. Senator Obama and Senator Clinton have sought and received hundreds of millions of dollars in these pork barrel unnecessary projects. And I don't say that all these projects are bad. I'm saying the system is broken. The system has become corrupt. And I say that not lightly because we have former members of Congress residing in federal prison. I led the Abramoff investigation. I saw what they did to Native Americans. And it's going to stop. And the Americans want it to stop. And I can do that. I can bring about change in Washington. I can bring about the necessary changes. And then, my friends, we're going to have to sit down together. We're going to sit down together, all Americans. And we know that we've got to fix Medicare. I mentioned Secretary Leavitt's speech a couple of days ago. We know we got to fix it. Are we going to hand off to the next generation of Americans this problem when every day it gets worse? Of course we can't. Of course we shouldn't. Of course we should. The same thing holds true with Social Security. But first we have to regain the trust and confidence of the American people that the dollars that they are sending to Washington in the form of their hard-earned tax dollars is being wisely and carefully spent. Otherwise, they will not have the trust and confidence in us to make the tough decisions. And these are tough decisions, and I want to say to you again, I know Harry Reid. He and I have known each other for 20-some years. I know these people well. I've worked with them all. I've worked with my favorite Democrat, Joe Lieberman. I've worked with all of the Lieberman fans are all over America. So I know how to reach across the aisle and sit down with them and work together. And I'll work together with them, not as Republicans, not as Democrats, but Americans who are going to fix these challenges and these problems that face this nation. And I hope that that answers your question, because we've got to prioritize. And frankly, maybe you can tell me, maybe now or later, what happens when your child grows older and you're not there, and you're not there. This is the thing that bothers me most about autism in America today. And thank you, and God bless you and your family. Yes, ma'am.
We have the utmost respect for you, Senator McCain. So you know where I stand before I ask this question. My husband's a doctor. We have a rehabilitation center, and we also have a laser therapy center and a massage therapy center. So we're from the provider end. So I want to drag you back to...
Could I just mention, laser therapy was unknown how many years ago?
Boy, it's a recent technology. We didn't even know about it until about 15 years ago.
And what does it do?
It stimulates cell growth and healing within the integrity of the cell structure. So basically, it takes away pain, it promotes healing.
Give me an example.
We have seen a fractured ankle that had been told it was going to take about 6 weeks to have any pain or have any weight put upon it, healed within 4 days. It's a very intensified healing process.
Again, giving a quality of life, but also a dramatic reduction in cost.
Absolutely.
All right, please go ahead.
I want to go back to what you addressed about defensive medicine. You are so on track with that. And unless you're in the provider industry, you really don't understand what a problem it is when we are required to do unnecessary tests because of liability issues. We are required to send out for sometimes 2, 3, 4 referrals, adding unnecessary costs and bureaucracy and costs that gets transferred on to the consumer, the patient. I have heard, I'm a Republican activist, so I've heard candidates say we need tort reform, but it gets stalled because the trial lawyers are a very active lobby, very powerful, very effective. So specifically, how would you counter that with a plan when it hasn't been effective in the past?
First of all, there's been a little progress, particularly in the area of class action suits, although that doesn't exactly apply to you. Clinical guidelines, a doctor, a physician, a caregiver who adheres to the clinical guidelines that are clearly laid out should be protected from suits. That's my first and overall principle, and I take it step by step from there. In other words, a clear set of guidelines as to what kind of care that a patient should receive and what kind of tests or procedures are necessary for that specific area. If that doctor, or that physician, that caregiver, that facility such as yours adheres to those clinical guidelines, then in my view, they should not ever have to go to court to defend what they did. Now, obviously, if there's egregious cases of malpractice, we want people to be allowed to resort to have their day in court. But I would have that as the first step, and other safety guidelines that would be, and today are, in effect in practice in America. We're going to have to do it step by step. That's one of the things that I have learned, is we're going to have to take it step by step, and because we're going to have to convince the American people. And as you said, trial lawyers are very, very powerful in America today. I respect them, and I respect their right to advocate for what they believe in, but I vehemently disagree with them. Yes, sir. Does that end? What would you like? Let me ask you, what would you like?